Hi, welcome to another edition of Orthopod. My name is Mo Bhandari, Editor-in-Chief of Ortho Evidence, and I have the pleasure today of interacting with Dr. Moin Khan, who is a shoulder surgeon with an interest in sports medicine, and also is the director of the Shoulder Fellowship at McMaster University. Welcome, Dr. Khan.
Thanks for having me, Mo.
So we're starting a session on Orthopod, Moin, that really focuses on shoulder surgery, but particularly interacting with experts in understanding trends. So I have three questions for you that I was hoping we can cover in fairly short order, which starts with the following. I'd like your opinions on what's trending in shoulder surgery. What are you reading that you'd recommend for others to at least read in shoulder surgery? And what types of questions are you asking right now in shoulder surgery? Those are the three things I'd like to get in, and this would be more of an update or a specialty update sort of approach. So why don't we begin with the first question? What's trending right now in shoulder?
Yeah, that's a great question, Mo. I think there are four main areas that I think are trending right now in shoulder surgery. The first one is people are really starting to question the role of surgery in shoulder impingement syndrome. The second one is biologics in rotator cuff surgery are a really hot topic, and we're really looking into what their role is. The third topic that I think is very hot is instability. And this involves the gamut from the first time dislocator to the dislocator that has some bone loss. And then the fourth topic that I think that is very hot is the role of templating and augmented reality and navigation in shoulder arthroplasty.
So there's quite a variety of things that are going on. So clearly it's a fast-moving specialty right now with respect to evidence and research. Can you speak a little bit more about the biologics? So what types of biologics are on the horizon, or what's being tested right now for shoulder?
Yeah, I think biologics are a really hot area because we know that a significant number of patients who have rotator cuff repairs fail, particularly those who have large and massive tears. And so there's this real need to improve the biology of the healing environment. And there are areas right now that are being explored in biologics, which include platelet-rich plasma, still a very hot topic. And further into that, looking more at the leukocyte-rich and leukocyte-poor formulations. There's also the role of bioinductive augments for rotator cuff repair, in which collagen patches are also placed on top of the repair to stimulate further healing. And there's also a role of looking into other treatment options such as growth hormone injections and that sort of thing.
When you think about biologics, which ones do you think ultimately may have the greatest promise in the upcoming few years?
I think platelet-rich plasma still holds a significant amount of promise. And the issue with PRP is really figuring out which formulations are going to have the biggest impact with the healing environment.
And when you think about, let's say PRP, for example, I mean, it's come a long way. When you think about all the other, indications for which it's been used, it does appear as though it's got quite a bit of evidence for lateral epicondylitis. We're starting to see evidence for knee osteoarthritis, and sounds like you're pretty confident now that there's going to be sufficient evidence to start warranting more of its use, and maybe it's already happened as it relates to shoulder. Is that fairly accurate?
Yeah, I think so. There was a recent network meta-analysis that came out of NYU that showed that leukocyte-poor formulations decreased re-tear rates in rotator cuff tears. So I think there is definitely a lot of research going on in the area, which may be very promising.
So that gets me to my next question. You're clearly trying to keep up with the evidence. So what would you recommend to our viewers in terms of a paper that would be a must-read paper that might highlight one of your other top trending topics?
Yeah, I think the area of surgery and questioning surgery for shoulder impingement is very hot right now. There have been a number of recent trials that have come out in Lancet and BMJ, JBJS that have really shown no significant benefit for surgery for shoulder impingement. There's a nice paper that just came out in 2020 in BJSM that looked at subacromial decompression surgery for adults with shoulder pain. It was a systematic review and meta-analysis. that I would recommend that provides a nice overview of the topic. And it also was accompanied with a BMJ clinical practice guidelines on the topic. So I think that's a nice topic to read around.
And when they're talking specifically about non-operative treatment being sufficient, is it truly non-operative treatment? Is it physiotherapy? Is it what were the conditions? So in managing those patients, now looking at it evidence-based, Dr. Khan, what would you be doing with those patients?
Yeah, I think for these patients, the studies included a whole variety of non-operative treatments as well as placebo or sham surgery. So for these patients, I think really pushing the physiotherapy, trying the anti-inflammatory medications, the subacromial cortisone injection is a mainstay for treatment.
And you think basically that should suffice. In other words, there's likely an additional added benefit than to do the surgical procedure itself or the surgical decompression.
Yeah, I think for the vast majority of patients with subacromial impingement syndrome, this treatment works quite well.
Great, thank you. And why don't we just finish off to, you yourself are an active scholar and researcher. So what types of questions do you have on your mind? And what types of things do you believe still need answers?
Yeah, I think one area that really needs an answer is the massive rotator cuff tear in the younger patient. There are many, many different treatment options that range from debridement to grafts to partial repairs to balloon arthroplasties. Superior capsular reconstruction is very hot right now, and we don't have a lot of evidence to really guide practice as to what treatment may be best for which type of patient. So that is a huge area that needs to be evaluated further.
So on that point alone, first of all, how common are these massive tears? And that, is there a reason that they're not seeing big trials because there are just not enough patients to recruit for these large trials? Or is it really just a prioritization of research questions?
I think these patients are quite common. And I think it is an issue of prioritization. We see these patients a lot in clinic. And I just think that the studies have not been done yet.
Okay, good. So there's lots of opportunity there. And are you aware of any studies ongoing in this area, or really you're saying it's a pretty wide open area right now for evaluation?
There are a number of studies ongoing. In fact, we are collaborating with the University of Toronto on a trial evaluating the superior capsular reconstruction versus partial rotator cuff repair in this patient population.
Oh, great. Okay, perfect. And you had said that there's some other questions you might have.
Yeah, the other question I really wanted to highlight is instability. Still is a very hot area. The first time dislocator, there are some studies that suggest a 7-fold reduction in recurrent instability with surgery right off the bat. So that is an area that is pretty hot. The patient that has recurrent instability already, should they be treated with a bony procedure such as a Lähdeoja versus a soft tissue procedure? We're doing a trial on that right now. And then the patient that has a significant amount of bone loss, should they be treated with a Lähdeoja versus a allograft procedure? Should this be done open or arthroscopic? All of these areas are hot topics right now.
And remind me again, so despite, what would seem to be decades and decades of research in shoulder, you still haven't come to what seem to be some very fundamental answers to questions. And it reminds me a lot of trauma, where the hip fracture, after, some 50 odd years of, tens of thousands of publications and many, many hundreds of clinical trials, still remains a very, unsolved fracture. Are we seeing the same in the shoulder?
Absolutely, Mo. All the available trials, if there are trials, are of small sample sizes, or there are just small comparative studies.
Right.
So we really don't have high quality evidence to guide our treatment decisions.
So you've identified two areas where there's a lot of opportunity for questions. Is there any others?
The other area that I think is pretty hot is with shoulder arthroplasty. Providing more information to the surgeon, whether it is preoperative templating and even translating that template using augmented reality in the operating room or navigation to help the surgeon. And a lot of these treatment decisions relate to fixation of the glenoid, which is a number one cause of failure for shoulder arthroplasty. And while this is certainly very helpful for the surgeon in getting a better appreciation of a patient's anatomy, it's still difficult to say what clinical impact this has, because there's not that much research on the long-term clinical impact of this technology.
Well, let me ask you this as a clarifying point before we close out, Dr. Khan. So when we talk about augmented and virtual reality, and we talk about all these, really, really innovative tools for education, is this more an application for learning as it terms, let's say it's a trainee learning, or do you feel that it's equally valuable for, let's say, an expert or a trained surgeon who has enough comfort and experience? Is there an additional benefit to VR and augmented reality in, once you actually have reached a certain level of competency?
I think there is still a benefit for virtual reality or augmented reality, even for the trained surgeon. Certainly for the learner, there is definitely benefit in practicing a technique. But for a surgeon who may not have performed a procedure or may not used a certain type of implant, this is a nice way for them to gain some experience before getting into the operating room. Or if they wanted to join another surgeon intraoperatively and experience their techniques virtually, that would also be an option. So there are a lot of applications that are available that I think have benefit for a broad variety of learners and surgeons.
Wonderful. On that note, I'd like to take this opportunity to thank you again for sharing with us your insights, Dr. Khan, and we look forward to further interactions with you as we are pretty sure that the area of shoulder surgery is going to continue to evolve and there'll be a continued need for more interactions and more evidence. Thanks so much.